Hello, Upstreamists. Last week we released episode 6, diving deep into the health implications of experimenting with basic income in Canada with Evelyn Forget, Armine Yalnizyan, and Danielle Martin. We did our best to take a balanced and comprehensive approach to the subject, but that meant leaving out a lot of the conversation. So if you just can't get enough Upstream Radio, here's the rest of our interview with Dr. Danielle Martin, perhaps the foremost Canadian proponent of basic income as it pertains to our health. Thank you so much for joining me, Danielle.
Thanks for having me.
So maybe you can just begin by telling us about why is income something that people should be thinking about in terms of their health and how it affects the health of our communities?
So I think that something that many Canadians don't realize is that the primary determinant of whether we will be healthy or not is not actually access to health care, but what we call the social determinants of health, including whether we have adequate income, affordable and safe housing, education, access to appropriate nutrition, and a whole host of other social factors. So when we think about health and improving health, we need to think not only about improving the healthcare system, but also making sure that people have enough income to be able to make healthy choices in their lives and have control over the many things that determine health and wellness. So in Canada right now, we have a situation where many Canadians fall through the cracks when it comes to income, and that leads to a negative effect on their health. That includes Canadians who are recipients of social assistance and disability support programs who are often not getting adequate benefits, not able to make the kinds of dignified choices that any of us would want to make, and really suffering as a result of that. But also, the majority of people who live in poverty in Canada are not receiving social assistance. They're actually working, but they're working in part-time jobs or minimum wage jobs, often cobbling together multiple minimum wage part-time jobs to try to make ends meet. And yet still falling below the poverty line. So we need to have a conversation not only about improving our social assistance programs, but making sure that Canadians who are working but falling below the poverty line can get access to the minimum standard of living that I think we would want all of our citizens to be entitled to.
So what's wrong with the social assistance programs we have, or put another way, why can't we just increase the amount of assistance we're giving people instead of just giving people free money?
So there's no such thing as free money. And in fact, the social assistance programs that we have currently are problematic for a number of reasons. The first is that they are inadequate. And so, the patients who I see in my office who are living on social assistance, there's no way that a human can make ends meet on the amount that they're receiving. But social assistance programs are also very invasive into people's lives and their choices. There's a lot of sort of policing that goes on. You need to prove who's living in your house, how you're spending your money, whether you're looking for work. There's a whole host of accountabilities associated with that, and a huge amount of infrastructure and bureaucracy that goes into trying to determine whether or not people are following the rules, with the result that, it seems to me that people who are living on social assistance basically have full-time jobs trying to please the system, and that's neither good for them nor good for the system in terms of the amount of administration, the amount of money that we're spending collectively on administration of those systems. But the second thing that's troublesome about our social assistance programs is that they, by and large, only cover people who aren't working at all. And so there's a perverse incentive not to work, because if you're not working, then you can access those programs and the benefits that come with them, such as drug coverage and other important supports that help to support health. The reason why I think many healthcare providers, including doctors, are lining up behind the concept of a guaranteed annual income is that it actually creates an incentive for people to work and is much less judgmental and invasive into people's life choices in terms of how they spend their money.
Do we have an opportunity then in escaping from a paternalistic sort of way of saying, okay, if you do this and this and this, and if our system and our structure judges you as qualifying, then you can have this to spend on a certain way? Do we have an opportunity to have a less paternalistic system, and does that have opportunities for our health?
I think there are huge potential benefits to health of having a system that is less judgmental in its construction about how people spend their money. And interestingly, what I think many people would be relieved to know is that studies that have been done on guaranteed income programs internationally, including the guaranteed income programs that we already have in Canada for seniors and for families with children, show that when you give people money unconditionally to top up their incomes to a level that people can live on, they spend it on exactly what you would hope that they spend it on. They'll spend it on transportation and housing and food and supplies for their kids. So the age-old kind of stereotypes about people in poverty spending money on beer and popcorn, as it's been put, are actually not founded in reality. When you top up a low-income person's income, they spend it on the necessities of life. So, in fact, not only are the sort of administratively burdensome eligibility rules that we have invasive, they're also unnecessary, because it turns out actually when you support low-income people in getting up out of poverty, they will use that money as you would wish that they would, and there's no need to spend extra money on trying to police how they do it.
There's a pretty heavy and intense conversation in Canada right now about whether to try basic income, what kind we should do, how to integrate it. Do you see health as having a particular capacity to channel or to focus that conversation?
I think that that the conversation that we have about poverty in Canada is probably not explicitly linked to our health often enough. In fact, when you ask Canadians what they care most about, overwhelmingly, they will always say that they care most about health, and they will also say that they care about health care, because I think that health care is a proxy for the collective belief that we should invest our tax dollars in programs that support the health and dignity of every person. And so talking and thinking about income as a way to support health is a new way to frame that conversation. And I think it's one that may unlock a lot of the kind of walls that we find ourselves walking into when we talk about how to build a better society, a better community across the country.
We spoke to Andrew Cash and Ritika Goel last month about how the new realities of precarious work in Canada are creating new challenges for our health. Do you see a process where basic income may be inevitable or absolutely necessary, or is it something that is an optional path for us to take?
Well, I think if we're interested in supporting people who are working in this new global economy where precarious work seems to be increasingly on the rise, if we're interested in supporting people in being able to take care of themselves and take care of their families, I'm not sure that we do have much of a choice. I mean, we simply do not live in an economy anymore where people go into a full-time permanent job, stay there for 40 years, and then retire. And we don't have an economy where they go into full-time work and stay in it and have benefits either. And so we do, I think, need to have a conversation about what the structure of benefits needs to look like to support people in that new economy, because most people do want to work and will work in the jobs that are available to them. And so it's our obligation, I think, as a community to think about how to make sure people don't fall through the cracks.
I haven't spoken with Armine Yalnizyan yet, but I know she's going to bring up the opportunity costs in terms of how we could be more subsidizing for housing and food security and things like that. What are the advantages, do you think, of a basic income type policy as opposed to doing more political policies to address other social determinants of health that would make it easier for people to live with less income?
Look, I'm a huge believer in the importance of universal programs. I believe in public health care, in affordable childcare, in affordable housing. I think, we need to make sure that all of those things are available to people living in poverty. And if all we do is put cash in people's hands, we would have to put really an enormous amount of it into their hands if we're going to eliminate all other benefits. So I don't think that anyone who believes in a universal basic income thinks that we should get rid of all other social programs. But the reality is that we already spend a lot of money on a social assistance set of programs that are fundamentally broken, that are inadequate for people's needs and invasive into their life choices. And so once we finish dealing with that, and then we look at the issue of precarious work and people who are sliding in and out of work or working and yet still falling below the poverty line, the reality is that we cannot fix the problems that those people face in their day-to-day lives simply by, giving them childcare. People need to be able to make choices of the kinds that we all want to be able to make about where we put our resources and what we do with them. And I think it is a mistake to believe that the state should simply provide services and tell people what it is that they need 100% of the time. I think some of the time what people need is agency and independence, and having enough income to be able to make choices for yourself and for your family is part of what that agency and independence looks like.
What do you think then the most important challenges and most important things to remember are for how we would implement such a basic income policy nationwide?
Well, Ontario has announced a pilot, and I think that there will be enormous lessons learned from the basic income pilot that's getting up and running in Ontario. I don't think that we know yet what the right way is to design it in all of its details, and so I think those of us who've been advocating for a pilot are relieved to see government being thoughtful about trying something on a small scale so we can figure out how to work the kinks out before we scale it up across the country. But my hope is that there will be other pilots launched across the country so that we can start to understand how does this program look different? How should it look different in Newfoundland versus in rural Newfoundland versus in downtown Toronto? And what are the different considerations that need to be brought to bear on its design? Because I don't think that it's going to be a completely one-size-fits-all solution across the country. But one of the very attractive things about a guaranteed annual income is that it can be pretty simple in its design. It's a tax-based policy. You submit your taxes, and if your income falls below a certain level, you get topped up, period. And so we need to understand what that amount is, how it differs from community to community, what some of the considerations might be with respect to seasonal work or part-time work or whatever, what the cutoffs would be, what the clawback rates would be. All of those kinds of things are important design considerations. But by and large, they can be sorted through with the implementation of a couple of well-thought-out pilots across the country. So I think that's the next stage in this conversation, is to try it out on a small scale, tweak the design, figure out how to make it work for a 21st century Canada, and then we can begin to talk about what it should look like implemented universally.
Do you worry sometimes about unexpected consequences? You and I both work with a lot of people who are passionate and dedicated and love what they do, but most Canadians hate their jobs, and are there enough opportunities for enough people to do something that will self-actualize and just occupy their time if they don't need to work to live?
Well, I don't think that there's any evidence to support that claim at all. There have been trials, experiments, pilots of basic income done all over the world, including here in Canada, and the impact on people's participation in work is minimal, if at all. So if it exists at all. So, most people want to work, and if you design a program that leaves them better off for working, most people don't actually want to live on the amount that would be transferred to them for in a basic income program. Most people would rather be productive, contributing members of society and out there in the workplace to the extent that they're able to be so. And what's nice about a basic income program is that they can do that to whatever extent they're able to do so, and then they can also hopefully go home to a safe environment and have enough food to feed their kids, which many people who work full-time in Canada can't say right now. So I'm not worried about a disincentive to work. Any program that's designed to allow people to keep enough of the money from working that they're better off working than they would be solely on a basic income pretty much eliminates that concern. And I don't think it's borne out by any evidence. I think it's really that when that concern is raised, I think it really comes from old-fashioned notions of deserving versus undeserving poor, and those are not notions that I really think we need to worry about too much.
That does seem to be a thing that comes up, is the radical, to some people, sentimentality is the radical nature of basic income. But do you look back in history in anthropological terms, and do you see parallels between basic income and past history for humans?
I don't even have to look back in history. I look at modern day Canada, and we already have a basic income for seniors in Canada in the form of the Old Age Security and Guaranteed Income Supplement Program, and we already have a basic income for family with kids in the form of the Canada Child Benefit Program. So I don't think it's a historical anthropological artifact. I think it's a reality in modern day Canada that we acknowledge that people who are living in deep poverty, whether they work or don't work, need to be topped up. The difference in Canada is we're doing it for seniors and we're doing it for family with kids, but we're not doing it for anybody else. And so now what we need to be talking about is how we bridge that gap.
Awesome. So let's talk a little about your book. It's called Better Now: 6 Big Ideas to Improve Health for All Canadians. What are the 6 big ideas that you talk about in your book?
So the book I'm excited about, it comes out on January the 10th, and it spans the recommendations span the lifespan in terms of what we can do collectively to improve health and healthcare. So I do talk about the basic income as one of the things that we can do to set people up for a healthy life, but I also talk about the importance of universal access to high-quality, relationship-based primary care. I talk about the need to implement national drug programs so that everyone has access to the medicines that they need. I talk about the need to reduce unnecessary tests and procedures in healthcare because we know that millions of Canadians are harmed every year by over-testing, over-diagnosis, and over-prescribing, something which also threatens the sustainability of our healthcare system. I talk about the need to reorganize the way that we deliver healthcare services, particularly specialty services, so that we can get better value for money and reduce wait times so that people can get access to the care that they need without having to invest more money in the healthcare system. And I talk about the importance of scaling up successful pilot programs because actually somewhere in Canada today, somebody has solved probably the challenge that you're facing in your own local community when it comes to healthcare delivery, but we don't do a good job of moving from the small-scale pilot project to the large-scale system solution. And so I talk about some ways that we can be better in Canada at scaling up those successes so that everyone can have access to them. So it's not a book about what we can do as individuals, brush your teeth or exercise 3 times a week or don't smoke or things like that. Although, of course, those individual choices are also important. This is a book about what we can do together and the way that we pay for and structure and deliver healthcare services in Canada so that we can actually improve the health of Canadians, which is, after all, the purpose of a healthcare system.
When you were writing the book, did you have a specific sort of audience in mind, or is this? Did you deliberately write it so it would be accessible to anyone?
This book should be read by anyone who has an interest in health in Canada. And so by that I mean every citizen. If you've got a child or an aging parent or a partner who's receiving healthcare services in Canada, if you yourself ever interact with it as a patient, if you care about health and want to see the health system improved for yourself, for the next generation, then this is a book for you. It's written intentionally it's filled with stories of the patients from my own practice and my own family. It talks a lot about how these various changes would affect real Canadians on the street in our day-to-day lives. So it's intended to start a public conversation about how to improve health and healthcare.
Great. I can't wait to read it myself. One more big question, if you will. You've been a national leader to a lot of people, a role model to a lot of people in bridging so many things that are problematic in our society about gender equity in health and in the social determinants of health. Do you see basic income as having a particularly strong impact in that regard?
It's interesting. I don't think of the basic income as being a sex and gender policy, but I do know that it's true that when pilots were implemented in the U.S. in the 70s, access to a basic income was found to be liberating for some women who were financially dependent on their spouses and therefore unable to build the kind of life, particularly a safe life, that they might have wanted to live. And so I think there's certainly that we may not know until we implement it in these pilot projects what the impact would be specifically on women, but I certainly think that there's the potential for universal access to a basic income, a basic standard of living for all Canadians to be helpful to women in particular in achieving equity.
How would you describe your personal feelings about a future with basic income? Is it something that you feel like viscerally excited about? Do you find yourself thrilled with the potential and the opportunities?
And when I think about what a world with a basic income would look like, mostly what I feel is a sense of relief on behalf of the people in my practice who I see struggling to deal with the labyrinth of paperwork and rules associated with our current income support programs. Yes, of course, I'm excited about the possibility or the prospect of what could, a policy that could basically eliminate poverty in Canada. But a lot of what I feel when I think about it is just relief about the burden of administration that people labor under right now on top of the poverty that they live in, and what a relief it would be to see that eliminated.
Wonderful. Well, thank you so much, Danielle, for talking to me today on these incredibly important points and bringing this health focus to the conversation for us.
Great. Thank you.
And to our wonderful Upstream community, thanks for listening and for keeping the conversation going with your friends, family, and colleagues. If you think our messages are important, please consider donating at thinkupstream.net/donate and help us take the mainstream upstream. You really can make a difference in what we do. Like Upstream Radio, you can also help out by liking, subscribing, and giving 5-star ratings to the show on iTunes, Google Play, Stitcher, and wherever else podcasts live. Join the Upstream conversation by commenting on Facebook, tweeting at us, or email us a voicemail or voice memo at storyshop@thinkupstream.net to have your say about what really determines our health in upcoming episodes. Until next time, keep thinking upstream.